Okay, everyone, we'll begin. Hi, everyone. My name is Shri Patel, and I'm from India Home. Today, my colleagues and I will be conducting a webinar on incentives in outreach work and educational sessions. I'd like to take a few moments to encourage everyone to write their names and organization name in the chat if you have not done so. And if you're able to, please turn on your camera. So for our agenda today, we will be discussing incentives, what they are, and its purpose. Then we'll be going over community needs and linking incentive use to community needs. And lastly, we'll end with a few key takeaways, as well as some suggestions on how to have CBOs and health departments work together in this incentive outreach work educational session realm. I'm going to turn it over to our team to introduce themselves before reintroducing myself.
Hi everyone, my name is Dill. I'm the outreach supervisor here at India Home. I've been with the company for a bit over 2 years, starting off as a community health worker and then moving my way up. I will be also co-presenting and monitoring the chat for any questions or concerns.
Good afternoon, everyone. My name is Victoria. I'm a community health worker with India Home for over a year. I'm also a graduate student in an epidemiology program. I work on the COVID-19 vaccine initiatives and will be presenting on incentive best practices along with Dill.
So hi everyone, to reintroduce myself, I'm Shri Patel. I'm a data analyst for India Home. I've been at India Home for about a year and a half, and I'm also currently a graduate student getting a master's in public health. A lot of the work that I do is related to making sure our deliverables get to our various grants on time. So I deal with a lot of the data in that sense. So just to begin, I'm going to discuss what do incentives look like. Incentives are any sort of free item that RCHWs use to place at outreach tables to hand to community members. And it's primarily to get community members engaged and grab their attention, create trust, and sort of begin that conversation. So our team has used a broad range of incentives throughout the years. It can be from anything from Metro cards to COVID related sort of items like masks, testing kits, to things that are small but essential like hand warmers. And then even sometimes some toys for outreaches that are targeting children. So one thing we wanted to mention before we begin diving deeper is how important target populations are in the sense of incentives. Um, Making sure that incentives match the populations you're trying to reach is essential. And these items are really to foster engagement and get the community members to sort of trust us, talk to us, start that conversation. So I'm going to hand it over to Victoria, who's going to explain this a little more in depth.
Thank you, Shri. So we're going to start off with why we should use incentives. Providing community members with an incentive in our efforts to reach them does help grab their attention, allows them to trust us, and even increase access to some things that individuals may not coin as a priority. For attention grabbing, when going to high traffic areas, meaning there's a lot of people, a lot of foot traffic, having materials displayed on the table or whatever prop you're using at the outreach makes us stand out, and people are more inclined to show curiosity. Then it's easier to start a conversation. Receiving something for free can create positive associations with our table, with the organization in general, at the outreach event. Continually being present at outreach events and education sessions with the incentives does send the message of consistency. And having name brand items, such as Perel, the hand sanitizer, also shows legitimacy. India Home, we found that showing consistency and legitimacy through brands encourages community members to interact with us more. They're more inclined to want to come over and more inclined to listen to what we have to say. Providing free incentives demonstrates that we are genuinely interested in supporting the community and improving the well-being of its members. So overall, showing goodwill and generosity. I do want you guys to keep in mind that providing certain materials for free during outreach and educational initiatives does increase access for community members that do have a hard time accessing some of the materials on their own. The price of masks, I'm going to use masks for example, the price of masks skyrocketed throughout the past like 2 years. They started going to a more commercial market. And we see items such as hand warmers during the winter or first aid kits as materials that community members don't necessarily invest in themselves. So incentives do help create access to these kinds of things. So when the mask prices skyrocketed, we were able to hand out free masks during the winter, handing out hand warmers. Not a lot of people invest in those when standing on food pantry lines during the cold. And even first aid kits, a lot of people are like, oh, you guys have those? They don't invest in them, partially because they are a little bit more expensive and probably not in their budgets. So I went over some reasons for using incentives, but I'm also going to briefly discuss the overall benefits. In the previous example of increasing access to certain materials like the mask and the hand warmers, that's how incentives meet the socioeconomic needs. Like I said, it might not be a priority in their budget. So if we give it to them for free, we are sort of filling that gap. Then community members actually often thank us for providing this stuff for free because they admittedly can't afford it or continually invest in it. Another gap to bridge is COVID-19 related materials. People were going to have to start coming out of pocket more for COVID-19 related materials, such as the test kits. And that is because of the federal distribution of the materials decreasing since last year. So we support this gap by providing free at-home tests and masks, for example. And we were doing this prior towards when they started having the at-home test online again for purchase. As far as where incentives should be distributed, um, oh, yeah, sorry. As far as where incentives to be distributed, distributing incentives at a coordinated location can help improve its overall effectiveness. So, a good example would be we're doing, if you're going to do like a vaccine sign up at an outreach with incentives, you want to figure out where is an appropriate place to do that. I want to hear feedback from the audience. Would you go to a subway station to hand out these types of incentives or a community event? Which one do you guys think would be better as an example? If you're going to do like a vaccine sign up outreach, giving out incentives to community members, does anyone think a subway would be a good place? You could do a quick hand raise or shake of the head. I'll give my opinion. I don't think a subway is actually a good place to distribute certain incentives, many incentives actually. So that's why we say case by case basis, coordinated with the location. A community event is a really great place to bring incentives. Just easier foot traffic. Even if there is high foot traffic, it's a bit more organized than a subway station. And handing out incentives when trying to sign people up for vaccinations, I feel would be more effective at a place like a community event rather than a subway station. Subway station might be better just for flyering, not so much incentives, if that makes sense. Any other thoughts? No? That's okay. So I'm going to move on to community needs. How can incentives be effective in meeting the changing needs of community members? How can you understand your audience when picking an incentive? And also, how can CBOs be further supported when providing incentives? As far as meeting the needs that are changing for COVID-19 related materials, the needs change throughout the years. That's because in 2020 to 2021, it was easier to get a lot of COVID-19 related materials, i.e., mask and test kits. Since 2022 and 2023, though, we did notice community members noted it was harder to get COVID-19 materials. So if we are addressing COVID-19, it's important to have materials for free that are available and related to that. So we started bringing more masks, more hand sanitizers, more COVID-19 related materials in from 2022 up and on compared to the previous years. As far as weather trends, you wouldn't hand out hand warmers or socks in the summer. So you want to follow seasonal trends. So incentives have to shift with the seasons as well. And finally, you want to determine what's appropriate. And we're going to discuss this further along in the presentation, but I just wanted to give you guys an idea of how the changes related to incentives also, I'm sorry, I said that wrong, how needs are changing, and that is related to the incentives. When meeting a community member with incentives, you want to encourage them to participate, but you have to differentiate between demographics in order to know what's appropriate. So, for example, holding educational sessions for older adults versus at a school will warrant having incentives align with these populations. So, you have to take age, like the previous site location, and the population itself into consideration. And these are just some examples: families versus day workers, children versus adults and older adults, schools versus older adult centers. And so I'm going to hand it over to Shri, and we can actually work on an example of this.
Thank you so much, Victoria, for sharing that information. So we are going to be doing an online brainstorming session. If anyone's used Poll EV before, please go ahead and follow the link that Dill will put in the chat, or you can go ahead and use the QR code. So please just follow the link using your phone, and once I activate the link in just a few moments, you're going to be able to type in as many responses as you wish to the question, what incentives would be suitable for school outreach? So applying the information that Victoria just shared with us, please consider some incentives, some incentive items that would be suitable for a school outreach. I will stop sharing and begin sharing the brainstorming session in just a few moments. Okay, everyone, so you can join using the QR code on the top here as well. And yeah, go ahead and write your responses, and we'll have a little discussion once we have a couple of responses going. Okay, we're starting to see some responses here. Kids masks, yeah, that's a great option. A lot of families find it very difficult to find specially sized kids masks in like regular stores like CVS and things like that. So it would be great to provide that information. Um, Up here we have folders, loose leaf, school supplies, goodies. Yes, children love being attracted to the toys, the erasers, the markers, pencils as well. Something to note is when targeting schools that have a lot of low socioeconomic status individuals, it is really important to bring these school supplies because school supplies are expensive. And a lot of times children are going through pencils, folders, markers, crayons, things of that sort so quickly. So it is really nice to be able to provide those things. Yep, erasers, that's a good one as well. Right. Does anyone have any other ideas of incentives that would be suitable for school outreach that they'd like to share? You can also go ahead and unmute yourselves if you aren't able to do the brainstorming session, or you could write it in the chat and they'll can relay the message. Okay, no other further incentive ideas. So thank you so much for participating. I'm going to stop sharing and then reshare the slides again and hand it off to Dill to sort of discuss how to align these demographics, as well as how can CBOs be supported?
Thank you, Shri. Earlier, Victoria did mention that it's important to figure out what locations are appropriate, but along with that, what kind of incentives are also equally important. And thirdly, like figuring out what population you're trying to reach out to. So for instance, I know we just did the activity on the school outreaches. So we had, I think along with the chat responses, we had pencils. One thing that we noticed is the kids really like tattoos, the temporary tattoos. They were very nice. Like we had dinosaurs, I think we had like dolls. We had like a bunch of different things. I think at one point we had like Pikachu ones. They were great. We have stickers. So those are the kind of things that we notice that kids kind of like to see. And it's also that like when the children see what's on the table, they're bringing their parents as well. So not only are you reaching the children, you're reaching the parents with them. So another outreach is the Home Depot outreaches. A lot of people are standing there for work. We noticed that carpenter pencils, those are the ones that don't roll off. So let's say like you're at an incline, you just place it over there, it won't roll off the same way that pencils do. It's very flat and there's like a ruler on there too. We also do first aid kits over there. You never know when you're gonna get injured. And then for food pantries, hand warmers, obviously like we do factor in seasonal, as Victoria mentioned earlier. It's when there's a line and it's very cold outside, hand warmers are very helpful. There was an instance where there was a woman that asked for the hand warmers. She said that hers wasn't working anymore. It turned out that she was using one that we had given her at a different location and she assumed that it would still be working. It did not. They only lasted 10 hours. So we just gave her another one and she was very happy to have them. Okay, so to be able to continue to provide these kind of incentives to the community, CBOs need support from, let's say, like the DOH, whoever's going to give us these grants. So we need budgeting leniency. A lot of grants kind of require for you to have these incentive plans way in the beginning before you start implementing the work. And it's kind of a lengthy process. You kind of have to figure out what you need to do for the whole process. And just having that leniency to be able to go back and make edits is very helpful. Another thing is that we need to like community organizations need to be able to give a little bit of insight. Like, okay, this is what works, this is what doesn't work. Sometimes there's like those restrictions where okay, you guys can't order, let's say you can't order non-perishables like chips and whatnot, but we notice like for like big community events, like snacks are things that kind of attract people. Another thing is flexibility in ordering, which kind of goes into getting the input from the CBOs. We want to be able to reduce waste, so let's say we order a bulk of items in the beginning, but we only because we can't make the changes later on, we realize like we might have a lot of leftover material that the community members might not want anymore. So kind of like let's say the instance of hand warmers, you can't give them out in the summer, but let's say we overestimated how much we needed for the winter, and now we're just left with so much more. And let's say the grant ends, and then what are you doing with the rest of this now? And at the end, just providing what the community needs, just hearing from them and being able to give them what they want.
Great. Thank you so much, Dill. I'm going to also go over another way CBOs can be supported. So, partnerships with local governments, this can include council members too, etc., because they potentially have the bandwidth to help CBOs acquire material. It's a good way to have a partnership with them. I'm going to use us for example. Once the federal emergency ended and COVID-19 test kits were being brought to a commercial market, meaning people have to pay for them, India Home partnered with Queens Borough Hall, which in New York City, it's kind of like City Hall, but in the borough of Queens. They helped us get test kits to make sure community members would still have access to it. And like I said, kind of in a beginning of the presentation. This was before they made them available online again. So this also shows meeting those changing needs. They weren't online yet. They were going to become expensive on the market. So we had to work with our local government to assure that community members have a place where they can go and get test kits, or we bring it to them. And they were able to provide it to us in bulk. As far as choosing an incentive, you want to ask these following questions. You should ask yourself or your organization these following questions. Who? Who is your target audience? Who are you trying to attract and educate regarding COVID-19 and its vaccine initiatives? Where? Where is the outreach or education session at? So remember, case by case basis. What? These are like W's. What would be a corresponding incentive with the demographic and the location? And can you justify these incentives to the funders, to the people that are giving you grant money, where you can purchase these types of things for community members? I feel like these are the 4 important steps. So we're going to go over a scenario, and I want your guys' input on how you would go about picking an incentive. Get ready to participate. All right, here's a scenario. Knowledge test. You are conducting a vaccine clinic at an older adult center. Your budget allows for incentives, and participants will get something for participating. I want to ask you guys, what would be appropriate, or what incentives would not be appropriate? Throw some things out there. What would you guys give out? And remember, this is a vaccine clinic, so they're providing vaccines to people. You're going to be educating people on why they should get it. What would you give community members for attending this event? If anyone wants to go ahead and unmute or put it in the chat. If not, I'll give an example, but I'll give you guys a second. No, no one? What about Carly? Maybe any ideas of what you would bring? Okay, so I'm gonna ask you guys this way. Would $100 virtual Amazon gift card be appropriate? Yes or no? For an event like this? I see heads nodding no. Right. Why? It's older adults. Not everyone is technological savvy. I chose this example actually because in New York City, oh, it's okay, Carly. Go ahead, girl. You gotta eat. That's okay.
Carly says she loves the Amazon idea.
Oh, okay. So you would give out an Amazon gift card, a virtual Amazon gift card? We had someone shake their head no, and I want to hear your idea on this. We said no because this, like I said, this was based off our older adults. We did have a vaccine clinic, and some of them did receive gift cards. But the thing is that they're online, and not a lot of older adults are tech savvy. So maybe if it was just like a regular community center, we did do a vaccine clinic at a homeless shelter. Yes, there you go. Younger audiences. Yeah, the homeless shelter we went to had a bit younger population, and they were very pleased with the Amazon gift cards. So yes, correct. Of course, of course. Yeah. Yeah. What about a carpenter pencil? Would you guys bring that to a older adult center as a reward for, like, yay, thank you for getting your vaccine. Here's a carpenter pencil. How do you guys feel about that? Probably not, right? No. Something that would be appropriate, I'm going to give an example of one of our sessions that we held. Messages are sending to oh, band-aids. Yeah, band-aids, first aid kits, grocery store cards. Yes, yes, band-aids, grocery store cards. Exactly. Things that the older adults can use that can help them. Yeah, thank you, Jiggy. Yeah, definitely. Yeah. I want to say one of our educational sessions that we had at our older adult center, we had them play a crossword puzzle game to understand the terms of the COVID-19 vaccine and infectious diseases. And there was a prize if you participated. So you had to participate in the educational session, which was quizzing your knowledge. And the prize was water bottle, some hand exercises for the older adults, and a crossword puzzle book. So all in like a nice little grocery bag, reusable grocery bag at that. So yeah, There's good ways to pick incentives, and I want to thank everyone for participating in this activity. All right, perfect. Let's go over some key takeaways. So some things I want you guys to take away from this presentation is you do want to advertise incentives as well. So we have a flyer here that was created by us to advertise a COVID-19 and flu workshop titled Winter Safety. To get attendance up, we did advertise free giveaway and resources. And I'm gonna use my line of thinking. This location actually provided the free at-home test kits. So we didn't provide that. Instead, we provided masks and tissues. Why? Because it was getting cold. A lot of people were getting sick. So masks, tissues, hand sanitizers, and some good stress balls. So those are the kind of things that we wanted to give out, but you want to advertise it as well. We see the mask circled here on the flyer as well. And incentives are helpful and can guide towards meaningful COVID-19 and vaccine education engagements because they are good attraction and conversation starters. That's the goal. You can't just throw the facts and guidelines about COVID-19 in people's faces anymore. Unfortunately, that's not something that's working. So if you do incentivize an outreach or workshop, it definitely helps. People are more likely to engage with you, and then you can kind of not trick them per se, but definitely move on and start conversating with them about the more important talking points. Customizing incentives is important. You want to make sure you're fitting the target demographic, and that will help maximize its overall effectiveness. Like I said, if you're giving older adults stuff that they want, they'll more likely be like, oh, yeah, no, we'll definitely come back and join the sessions with you. And then they're engaged from that point on. And also having material other than COVID-19 resources is effective. Not everyone wants masks. Not everyone wants test kits. For India Home, at our food pantries, we found that masks were popular, but at schools, the adults didn't want masks necessarily. It was more they wanted masks for their kids. So it's not, it really depends on a case by case scenario. But those are the key takeaways that I want you guys to have from this presentation. So I'm going to hand it back over to Shri.
Thank you so much, Victoria. You shared some really valuable information that I hope everyone here can take away with them. Does anyone have any questions? Please feel free to raise your hand, unmute, or type in the chat, and will relay the message. It may not even be a question. If you have a concern, a comment.
Any feedback? No problem, Carly. Thank you so much. I hope this was helpful. Awesome. I know we have a new attendee here, Mr. Paul. I don't know if you heard anything that we did talk about. Oh, thanks. Perfect. Awesome. Yeah. Yeah, of course. Anytime. Thank you. Thank you for attending. Hope this was helpful. Thank you, Jigit, for coming.
All right, so if no one has any questions, thank you everyone for joining us here today. We really appreciate your time and participation in our fourth webinar in our series. We will send a follow-up email with a copy of the slides, as well as a list of the sort of poll answers that we came up with here today, as well as a document outlining these steps on how to choose an incentive. I've attached your emails to the slides here, so please feel free to email us with any questions or concerns if you don't have one right now. If you have one, if you think about this presentation tomorrow, the next day, please feel free to email us with any questions. We will be conducting another webinar on February 29th, Thursday, 2 p.m. on meeting target populations where they are. If you wish to join us, the registration link will be included in the follow-up email that we send. Please feel free to share that with anyone in your organization or anyone that you may find that may be interested. Thank you again, everyone, and have a great day. Bye, everyone.
Bye. Thank you.